Welcome to a dementia-friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Staying Strong by Dr. Judith Cooper, sponsored by Prince George's County Government and Department of Family Services.
Hello. Thank you so much for having me tonight. I'm very happy to share, and I hope the information that we discussed today and review today can be helpful for your day-by-day activity. And I want to start with this presentation that it has been a collection of the population that I treat every day in different settings, and with the goal of going to the point of prevention more than wait until we have a sign or symptom of something that is affecting us in our activities of daily living. So saying that, so stronger seniors, as the word said, is we have to see our life not as a point that age related, is how our body feel, how we can keep our body as healthy as possible to do everything that we like, everything that we love, and stay as independent as possible. And we are living in a society that the aging population is growing more and more. And based on the census, they're expecting that by 2050, we're going to have more than 20% of American population will be older than 65-year old. And in fact, that is very good because that means that the advances in social, medical, and economic effort have been doing a good part in our lives to make us live longer. But saying that is that make a change. That's a challenge that's coming across too, because getting older means that we have to redirect our activities to stay as healthy as possible so we can stay as independent as possible. And that's the challenge that we see, because when we have more chronic health problems, we have to, because the life expectancy is longer, we have more expenses in medical and everything that has to do with the age. So basing our life in prevention is going to make a change in the growing pain related with the age. I want to highlight the fact about wellness. Why wellness is important, okay? Wellness should not be focuses only for somebody who wants to practice sport, for somebody who is in the young age. No, wellness has to be through all the lifespan. And I say that because having a wellness center in our is give us three access. They can help us have overall health and disease prevention, accessibility to wellness services, and social engagement. And later on the presentation, we're going to see more about what is the importance of having a wellness center. Going back to something that I hear every time is, and that's what we need to change is, oh, I have an old and more than 65 and old, and this is normal. Actually, that shouldn't be the case. Because we are older, that doesn't mean that we should accept that we should be in pain, or we should accept that we are not social engaged, or we are not participating in any physical activity. What we can say about disease and injury preventions. During the lifespan, we have different and very common disease and injuries that occur. One of those is that the normal aging one that we say arthritis, osteoarthritis, osteoporosis, a chronic pain for overuse of the joint. Most of the time happen because of repetitive movement that we perform during a lifetime, the type of job, activity, because we can be very active and we practice an activity that makes us overuse the joint, or we are sedentary and the lack of activity cause also that joint to get affected, get an injury. Have been expected that approximately 1 in 4 people over the age of 65 falls every year in the United States. Combination of factors. And as I mentioned previously, like how your lifestyle. If you are sedentary, or you have weakness, dehydration, and medication side effects. And I'm gonna talk more about that. How you can get falls because you have a sedentary lifestyle. When somebody is spending more than an hour or grossly, they don't do any physical activity, a lot of sitting, your muscles and your joints, they don't have that mobility that you have. If we talk about the joint, it's very common that we say, oh, my joints are cracking, or they are making noise when I move. In between our joints, we have some fluid. That fluid is necessary to keep the lubrication of the joint. When we don't move, not even walk, or we don't get up around the house, that can cause that joint to deteriorate. But it's not only the joint. Let's talk about the muscles. When we sit, or we don't move, or we don't do any function activity, anything that is active, any kind of physical activity, those muscles start getting weak. They start losing muscle mass, and they don't have the strength to perform the activity that we are used to it. And we can get cramped, and we have difficulty to move around. How dehydration can cause falls? That's a question that everybody asks, why dehydration cause falls? Dehydration cause falls because dehydration can drop your blood pressure. And if your blood pressure drop, you lost control of your body and you get dizzy. And then you can have a fall. Sometimes we say, oh, we get dehydrated because summertime. But not necessarily. The higher percentage of individuals that have dehydration in seniors occur in wintertime, in this time of the year, when it gets colder. And the reason is because we don't have the need of drinking water or fluid for 2 reasons. 1, because we don't get thirsty. 2, because we don't want to go to the bathroom because it's already cold and the water is going to make you go faster. So it's very important that we stay hydrated. to prevent fall and decrease the blood pressure to get dysregulated and lower. So if you are a person that check your blood pressure and you notice that your blood pressure is low, and that will be one of the things that you would like to check. Have been drinking enough water? Have been hydrated? Or something else? Also, medication side effects can cause falls. Why? Some medications say they have as a side effect drowsiness, sleepiness, weakness, dizziness. So it's very important to keep our eyes on that too, to identify what could be the cause of fall. By 2020, the estimate annual cost of falling events among seniors is expected to total more than 67 billion, encouraging seniors to participate and exercise at their local wellness center may help reduce this outstanding number. And we're talking about 2020. We already 3 years passed, and the number has been increasing more. So it's very important that we stay active as possible. Let's talk about accessibility. One of the things that we always have, if we have the opportunity, either resources. Resources are important. You belong to a support group. If you belong to a wellness program, if you have a group, they always have you can ask for information regarding those services that they are providing the community. Community wellness center. That's the more common name is recreational centers, therapy services. Depends on what is the need. Okay, what is the need that you have? Is it just to stay active and be in a pursue medical fitness? You can participate in those community wellness centers. If you have a specific diagnosis that is affecting your quality of life, then you can access those resources online for a specific group, and they can direct you to the specific resources to help with that chronic illness or to that lack of mobility or the conditioning that you have at that moment. Why social engagement is important? And that's across the lifespan. It's not something that is specific only for seniors, it's to all age group. Social engagement is very important to decrease depression. Unfortunately, yes, we went to the pandemic that we was socially restrained, and a lot of people went to depression. Depression is not normal part of aging. Okay, that's something that has signs and symptoms that when we identify it, maybe not ourselves, can be a significant other, can be a family, a best friend, somebody who knows us better, that know that those are not, you are not presenting yourself as your normal. And when we see those signs and symptoms that you stay isolated, you feel that you not feel motivated, you want to be by yourself, you don't want to do anything. Sometimes people cry without no reason, and and then other signs that we can we have a whole topic just for depression. It's very important that we take advantage also of those community wellness centers, those recreational centers, those support centers, those groups that you can participate in programs that some of them have once a week, every other week, that you can interact with other adults, okay, share experiencing, and then learn from each other to reduce symptoms of depression. If we're going to senior outreach effort, okay, it's very important to understand that exercise and social engagement is so important for seniors. But at the same time, it's very important to understand that barriers can exist and can affect the access of the population to exercise and social engagement. For example, it don't count with the support of somebody, a caregiver or transportation, or a wellness program close by home, or of the resources, everything, most of the resources that I noticed that I hear from that seniors have as a limitation is the family support, caregiver support, transportation. Sometimes we have when they join certain groups, the group have access to transportation services, especially if they have somebody that can be a caregiver or somebody that's a volunteer time to take them to doctor's appointments and to take them to to the groups that they have to do for exercise. But that's the biggest barrier regarding with exercise and social engagement. The good thing that we see now that technology have been breaking the barriers to the point that like now we're using the in-service through the internet, social media. So to keep that connection is very important. To keep that communication is very important. Yes, will be ideal. It can be in person, but also is important to take advantage of all the opportunities in order to stay connected with what is up to in the community and what can help us stay strong physically and emotional. Implementing programs that appeal directly to seniors can help increase engagement and retention. And those are like will be programs like I would say exercise for seniors, or let's do walking program for seniors, like age related. When is you see connection or point of interest can be that maybe not be age related, but can be like a group of people that would like to, they are very into walking and then decide to have that connection, or they are into gardening and it's an outdoor activity. So it's a social engagement, and at the same time, you exercise. It's different way. Exercise is not only a take a weight or getting in a bike or running or anything that had specifically gene related. It's any functional activity where you have to do active movement and where you can do it for certain amount of time that you feel that your whole body is working. So it's a very broad concept about exercise. So when we talk about seniors appropriate equipment, that when we focus on that, it's based on what is the biggest issues that we see with somebody depend on the age group. If we're working with seniors, we want to be sure that the equipment that we're using is gonna be safe for any age group. But if we're going to a senior appropriate equipment, we will say, okay, we want to ensure that the equipment is going to be easy to get in and get out, that the equipment is going to have the appropriate weight for to prevent injury, that the equipment is going to have some kind of support if the person is at high risk of falling. And then also it's very important to have somebody where you can ask or redirect questions, so you can feel that you have the expert in the room that can give you that support if something is not working properly to prevent injuries. They say that modern technology has helped streamline communication between healthcare providers and improve diagnostic accuracy. And that's with all the new equipment that we see, that they have database that you can run reports. Actually, the more common is those falls prevention equipment that you just get there, stand there, and they run a report. The healthcare provider read it and can give you like a conclusion or read the results and tell you, okay, this is what's going on, what I see, that what you're missing, what is happening, and also for the ones that they can tell you, do a diagnosis about your muscle strength. And I briefly talk about this things that are related with the age group. So let's go more in detail in this section. We're talking about senior focus classes. When we have focus classes, group exercise classes specifically geared towards seniors can help older adults exercise safely and engage with their peers in a meaningful and enjoyable environment. And that is because we base that in an average. When we have we have average for everything, we say, okay, we have a class for seniors, and we know that then the average is that somebody in this age group, to prevent injuries, we're gonna do this amount of repetitions. 10 repetitions with resting periods. Resting periods are longer, and the repetitions are, we do more repetition with longer resting periods, and at the same time, the speed is slower. That don't mean that, okay, you are not keeping up. No, it's just we are trying to be sure that the exercise based on the group population is appropriate to have the same outcome. No matter how the exercise is performed, what we want is the same outcome. The outcome with senior focus classes or children classes or athlete classes is prevention, strengthening, endurance, conditioning. So when we address those 4 points, we address it with the same outcome, just that the way or the trade that we follow to get to that outcome need to be a little bit modified based on the group that you are providing the services or the exercise. That's the reason that it's very important that when we join classes, you know what's the group that's in the class and that you're going to be able to engage in the class and you're going to enjoy it. Suggestion for senior-friendly classes, they include yoga, chair yoga, Tai Chi, walking program, meditation and mindfulness training, dance classes, those are wonderful, swimming aerobic classes that are very popular, boxing and cycling for Parkinson, and also having used for other diagnoses too. And boxing can be for any group. Then for briefly describe the classes, I would say that yoga is going to provide flexibility. So one of the things that happen with age-related, is that we lose flexibility. We get a little bit stiff. Your joints are not like good lubricated that we're supposed to. And also we lost endurance and then we want to unstrain. So if we talk about yoga and Tai Chi, those are good for flexibility and also for in a condition endurance. Walking for endurance and also to it's a impact activity, low impact activity that cause that the joints constantly a mobility of the joint, and at the same time how is walking is considered one of the best exercise for somebody who have a osteoporosis or risk of osteoporosis, to say better, or they have low endurance and you want them to get conditioning. Meditation and mindfulness training is good for stress. It's good for somebody who have a we say going to emotional, mental fatigue. It can also for depression. Dance classes, it's very fun. It's a combination like aerobic, a full mobility, social engagement, swimming aerobic classes. If you having problem to do exercise in a regular in regular surface, the water makes you feel lighter. You feel that that you can do more in the water because you're not carrying your body weight. So you're not putting a stress on your joints, and also build your endurance. Boxing and cycling for Parkinson and for anybody who have any kind of rigidity or lack of coordination, those are very good for it. Sorry, okay, okay. Let's talk about bone health. Okay, this is one of the more common topics. healthy bone can help you stay strong and active throughout your life. If good bone health is achieved during childhood and maintenance, it can help to avoid bone loss and fractures later in life. Okay, and that's a fact. Okay, so what this sentence say is that bone health is not, in a few words, is not age related. Okay, it's something that we have to start from the beginning of our life to have a better outcome at the end. So we have to do maintenance through our lifespan. And that include everything. And that include how, the eating habit, how active we are. But that don't mean that it's too late. If you have not been doing anything, like you was not very active in when we was younger, that don't mean that it's late to start. It's always very important to take action, no matter when we find out that we should take action. So osteoporosis, as I briefly mentioned previously, is a common bone disease that affects both men and women, mostly women, usually as they age, and is associated with low bone mass and thinning of the bone structure, making bones fragile and more likely to break. So, how we find out how our bones are, is they healthy or not? When we get us 50s, sometimes you start having symptoms. We get what we call it DEXA exam. It's a bone scan, and your doctor, your rheumatology, or your primary doctor can tell you, oh yes, you haven't some loss of bone loss, and we have to take action about it. And then we take all the supplements, vitamins, calcium. We try to eat food that is help you get those resources to you in a natural way. And at the same time, walking is very good because that constant, it's amazing how our body work. Walking, that impact every time that we walk, it's like a create some kind of a activation in our joint. It's like those cells start feeling, when they feel that impact, those cells start creating more cells, and then they trying to recruit and trying to replace and build the bone. It's like is part of the of how the body reacts for protection. So when you go to your doctor say, oh yes, you're having some osteopenia. Osteopenia is before osteoporosis, and they say, okay, now you're gonna need to take those vitamins, calcium, vitamin D, and so on and so on. So it's when if they find out that's too advanced, they give you Fosamax. But in summary, they mention, oh, as an exercise, walk. You maybe hear it, maybe not yet, but they say walk, because impact activities help the joints activate the cells that are in the bone and make it stronger. So that reason that active life, physical activity, is a good resource, is a good tool to combat any sedentary or a disease or chronic pain on the joints. as arthritis do. What are the benefits of good balance? Benefits of good balance is that they're going to reduce the risk, risk of falling. And again, that is when somebody fall, it's not exactly about falling. It's what happened. It's with fall. What can be the side effect of falling? What could be it can be fractures. And the more common fracture that is that we see from falling is hip fractures. So it's very important that in order how we can have a good balance, it's very important that we improve our posture, our core stability, the coordination, and we say how that will help with my balance, and I'm gonna tell you why. If you have a good posture, imagine that you're standing and you have a line that goes through your head, through all your body down. If we are not standing straight and we have the line crossing from your top of your head down, that line won't be straight. That line is going to be diagonal, or it's going to be diagonal in front of you or behind you. If we look at it in that way, and we are slumping or we are all leaning forward, if we bend forward too much, we can fall forward. If we are bending forward, but we are like leaning back sometimes, we can fall back. So posture is important. The strength of your core muscles is important because they are helping you with your postural muscles. Which one are your postural muscles? Your postural muscles is your core, is your hamstrings, your hip flexors, your leg, everything that keep you in the middle. Okay, in the front, it's like in the front and the back. Coordination. If we don't have a good coordination, also we can have falls. Why? Because if the lack of coordination can make you trip. Like if we don't coordinate our arms, if we are feeling that we do more than one step with the same leg and then catch up with the other one, and then we're trying to move the hand, all that thinking between that you notice that you are not having a good mobility between your arms and your leg, and thinking about it, that can make us lose our balance and fall. An individualized exercise program prescribed by your physical therapy may include a walking regimen, can be also Tai Chi, and other exercise geared toward conditioning, balance, and coordination. Definitely that is just a general description. It's like if you have somebody that you're already working on. So I met individuals that they have a personal trainer, and to stay motivated. Some people are very good staying active by themselves. They're very organized. They know they have set a goal and they can do it on their own. Other people need a body, somebody who can motivate it, or set goals or challenge each other so they can stay active. And then we have the other one that they need somebody who get them a routine and guide them. So I would say that if you are very healthy but not motivated, yes, you can use a personal trainer, or you can have somebody that can exercise with you, a friend, a peer, somebody from the if you are in your wife, your husband, uh, but somebody who can do the exercise with you. But if you have a chronic diagnosis, it's something that needs more attention, something that you cannot just decide like, okay, something pop in the new in Google and everybody's doing it, and you're not sure there's going to be a contraindication for you or you need to modify, I would say look for a healthcare professional to guide you, to give you the right routine for you. So we have been hearing this over and over, okay? And I think that we all understand that the main reason why we need to stay strong as a seniors is because we want to decrease the risk of falling. We want to stay as independent as possible. We want to be able to navigate inside our house or in familiar areas. We are with minimum risk of falling. And then also if you depend on somebody in outdoor or you can or anything, but still you want to be able to do it as efficient as possible. It is not any major contraindication or factor or diagnosis that can put you at risk of fall and you necessarily need somebody to be next to you or supervise you or give you that confidence to navigate the outdoors. So we have two type of risk factor for falls. We have the intrinsics and we have the extrinsics. The intrinsic is all that are related with ourselves. The extrinsic is everything that is in our surround. As intrinsic factors is what put you in risk of fall. Previous falls, okay, advanced age, muscle weakness, gait and balance problems, visual changes, postural hypotension, chronic conditions including diabetes, stroke, Parkinson, incontinence, and dementia, fear of falling, and neurological disorders. And then I'm briefly gonna go, I can spend an hour in each of them, but I'm gonna be as briefly as possible. So previous falls and fear of falling, I'm gonna put those together. Okay, it's intrinsic factor. If somebody has been having history of falling, or definitely they're gonna be fear of falling. And when that happens, that person change automatically the way how they walk, the way how they see the surroundings. They are more apprehensive. They want, and you might think that that is gonna make you safer, but not. It's gonna make you more at risk of falling because then you are grabbing everything and supporting everything to prevent the fall. Advanced age, they put as an intrinsic, and that because if you are having other problems like that you are having those chronic illness that they're related with age related, they might, or low endurance that can, and you was not active, the age can be more a factor. Muscle weakness is one, and that's straightforward. Gait and balance problems also can be a fall risk because if you are not walking properly or you're unsteady when you're walking and moving around, that it puts you at risk of falling. Visual changes. If you are not seeing where you're going, if you feel that at night, then you have problem with night vision or navigating, so we have to make certain adjustments of that. Postural hypertension, if your blood pressure is affected when you get up. This is very common. Some of my patients said, oh, when I get up in the morning from bed, I get very dizzy, okay, and I feel very unsteady. So that's postural hypertension. A chronic condition, diabetes, stroke, Parkinson, incontinence, dementia. Diabetes is because the common neuropathy is you don't feel your feet, you don't feel where you're touching. You don't. Some people that have diabetes are able to compensate, and they can tell, they develop other sense, so they don't are very sensory. Although they cannot feel the floor, they can tell you they are still steady, but others, they are feel very off when they cannot tell if they touching the floor, where they're standing, and that make them as a risk of falling. A person that have a stroke, it's because the weakness in the side that have been affected, that they don't have equal standing, and that can be a factor. Somebody with Parkinson is because the rigidity and the shuffling, the walking, the lack of picking up the feet, they can grab and gets problems to navigate on an uneven surface. Incontinence, that is somebody that have to run to the bathroom in the middle of the night, get up in the middle of the night, the lack of vision, the light can cause, not because you are imbalanced, because you are rushing to go to the bathroom, and that can be on unpredictable fall. In dementia, definitely you forgot what you need to do. You don't have a awareness of safety. Then in the extrinsic part, we have the polypharmacies, improper use or assisted device, lack of stairs, handrails, or bathroom grab bars, dim linings or clear obstacles, and tripping hazards, a slipper or uneven surface, a alcoholic. So in this one is definitely polypharmacy is somebody that takes more than 4 medication, and then the interaction of those medications can give you the effect of sleeping in, drowsing, and so on. And the improper use of the assistive device. So we have to be sure that the person is trained how to use the cane, the walker. And then if you are in a risk of fall or very unsteady, we recommend to put handrails or bathroom grabs. And then if you are not very good navigating the dark, also recommended to use put lights so you can see in the dark. And definitely be sure that you clear those areas like area rubs and stuff, things that you can trip at night. So here in, I would say, healthy life require exercise regularly, eat healthy, reduce the stress, and drink plenty of water. So they say that if for water, it's very important that we drink at least half of our body weight if you don't have any heart problem or restriction about your fluid. Just to stay hydrated and prevent any other problem, and then a good digestion. Keeping active and eating well is very, very important, okay? Because that is going to give you this fuel that you need to have a muscle strength, muscle strong, and also to maintain your healthy bones and everything. So it's very important that you have like an eating balanced diet with plenty of calcium, vitamin D, and any supplement that's needed so we can preserve your bone health. So in conclusion, according to the prediction of the United States Census Bureau, they say older adults will outnumber children by the year 2030. So we're going to be more, the age group is going to be bigger in 2030 compared with children. So as we see that with everything that have been happened, we are living longer, but then we having less children. So that's the reason that like they say that we're going to be doubling the numbers. So, and it's very important, right, that take advantage of the wellness facilities that we have in the area. So it's more and more we are up to looking to promote prevention over to treat a diagnosis or injury. And then so because we feel good and we don't have any symptom, that don't mean that we're not doing anything to keep our body healthy. Or it's like let's think about your body like a car. We have to give it maintenance. So that will be the same. We have to give it maintenance by exercise, participating in all the areas, not only physical, mental, emotional, everything. And as I mentioned, the type of exercise, we have the chair exercise, core exercise, resisting band exercise. So we have, I just briefly, because I said we have like I'm going to share these videos, the link, so you can see it. I'm just briefly going to, so we have this, it's a share exercise, but you see, working in endurance, working in mobility, all your joints. She's showing how to move the arm, how to move the legs, the turn rotation. So if you have the opportunity to sign in a program that is going to keep you active, why not? Try to go over. This is like, and then I say I'm going to share those links so you can do a form. So we also have demonstration about core exercise. So and then everything, not necessarily has to be, those are what I mean is you can perform all those exercise without needing to have a fancy equipment or going to a fancy place. You can do it from home. And this will be more. So she showed you how to do yoga, how to have a good posture, how to do breathing, how to control your core. And again, I'm going to share all those videos so you can look at it. The same with resistant band. This is also a good video to share. You get a band, they come in different colors. I would say that it get the yellow is the lighter, and the black is the more resistant. So, and then also they go through the whole routine, how to do arm exercise and leg exercise. What I want to say is that I hope that this presentation give you some tools about what you can find in your community. Look for, I would say that the first place would be your recreational center, to find what classes they have, things that you can do in commune. Very common, they do the pool activity. It's very important that you stay as active as possible to prevent chronic illness and stay as independent as possible. And again, thank you for inviting me today, and staying strong.